Hello. So let us start with the women-centric schemes today. We will finish women, education, and health for today. So the human development aspects which are in this chapter will be completed. So first we will see the women-centric schemes. So what is the first scheme? The first scheme is Santwana. Santwana basically means Santwane Kododu, something like that. Means basically counseling. Counseling, basically it is a scheme which was launched in the year 2000 to 2000 in 2000 and 2001, and it is mainly dealing with counseling and legal assistance to the women who are affected by the societal issues. So if any woman needs counseling help with respect to legal affairs, she can use this scheme, Santwana scheme. Then we have Swadhar Graha or Shakti Sadhana. So from name only it is clear. Swadhar Graha, Graha something related to home. So it is basically to provide the shelter homes to the women, and it is basically a central sponsored scheme. Means generally 60% is contributed by the center and 40% by the state. So one thing that is important here is it is not done by the government. Means here the funding is by government, but the implementation and all is done by the voluntary organization. Then we have Ujawala scheme. So these two schemes are actually very similar when we look from the spelling or the looks purpose, Ujwala and Ujawala. So we have to know the difference between them. When there is double J, that is Ujawala. This is Ujawala scheme. Ujawala scheme is by Ministry of Home, that mainly deals with rehabilitation of the traffic women who are majorly from the bordering states. For example, many women in Karnataka and Maharashtra are trafficked from the eastern states like West Bengal, Odisha, and all. Na? So if they are saved by the policeman, so they will be rehabilitated and they will get some amount or some other skill and training to continue their life. So that work is done by Uja Wala scheme, that is double J. Then we have Ujjwala scheme. So this scheme you might have known. This Modi had asked to give up your subsidies or gas connection. No, that scheme is this Ujjwala scheme. So this is by Ministry of Petroleum, and it mainly aims to provide free gas connection, especially to those who are in need. And the subsidy for this is under the Pahal scheme. Then we have Saki One Stop Solution. So what is this? So you have seen here. It is basically what is there? No? This is an umbrella scheme. Means here we were seeing like one scheme is for the legal assistance, one scheme is for the providing shelter, one scheme is a rehabilitation. So all this they have brought and clubbed under this one scheme. Saki, anything this will be there in each district. If there is any kind of issue or for any woman, they can go to this scheme. So this is a one-stop solution. Saki. This was launched in 2015, and in Karnataka, it is active in all 31 districts. Then we have Stree Shakti scheme. So this is also an older scheme, generally of 2000. And what is its main purpose? Its main purpose is the economic empowerment of the self-help groups. Means there was a scheme called as Amruta Kiru Udyami scheme. So under this, the women self-help groups were promoted so that they can earn some livelihood and get the entrepreneurship in them also. Then we have National Creech scheme. Creech means Joli, I think what do they say? Tottilu, sorry. Screech means Tottilu. So National Creech scheme basically deals with daycare facilities. So the children of 6 months to 6 years are given daycare facility. Then generally this is a scheme of central government. We have a very similar scheme of this in the state government, that is Kusina Mane scheme. Then we have Gruha Lakshmi. So this is very important. So in Gruhalakshmi scheme, this was actually launched in the year 2023. It is mainly to provide rupees 2000 rupees for one woman in one family every month. So this is like given to the who are eligible under this BPL, APL, Antyodaya, all are eligible actually, but only one woman for one family. This mainly aims to increase the decision making power of the woman if she gets some at least 2000 rupees per home. So there will be some say as per the government. In reality, don't know, but yeah, they feel that having 2000 rupees per month will ensure her much more decision power, and around 1.28 crore beneficiaries have already availed this service. So, and it is not for the government services. means or not for government servants, so like they cannot apply. And one thing we have to know is funding. Last year 28,000 crores were given, and this year 17,500 crore is given. Then we have Shakti scheme. So this is the bus scheme. So this was also launched in the year 2023, and it is applicable for the all four bus corporations. That is KSRTC, NWKSRTC, other than all those, it will be applicable. And some important facts here: the 50% of the seats in bus are reserved to the men, and no minimum kilometer limit is applicable. Then we have Dowry Prohibition Act. What we have to remember here is the act when it was enacted. It was enacted in the year 1961 by the central government, but the state adopted this in the year 2004, and the person who deals with the issues of the dowry in the state is the DC. District Collector is the head, and it is a non-bailable offense. Then we have to basically see Anganwadi workers and helpers death relief fund. So if any Anganwadi and Asha Karakatas die, so the government is giving around 50,000 rupees in case of their death. Then we have Bhagya Lakshmi scheme. This scheme was actually launched in the year 2006. So this is by combination of the Department of Women and the Postal Department. Means these together are collaborating and working under the scheme Bhagya Lakshmi scheme. This is basically it has main aim to improve the sex ratio. So how means generally the when the girl child is born, they tend to do harm it at the birth only. So this is basically a financial incentive to have a girl child. Say for example, when the girl child is born, from 0 to 2 years, means from the birth to 2 years, you have to register under the scheme Bhagya Lakshmi scheme. So you have to monthly contribute some amount of fund money, and the same amount of fund is contributed by the government. So at the age of 18, when the girl child achieve 18, generally it is the place where decision is taken to go to school or marry her. So when if the parents have money, they will directly send it to the higher education. So at this stage they want to ensure the money is there with the parents now. So that's the reason this scheme has been launched. It is only for the BPL, and it has to be registered from the 2 years to 0 to 2 years, and it will be, can be withdrawn from 18 years. Both government and the parents will have to have equal contribution, and the maximum contribution is 1.5 lakh. That is equal contribution, means 1.5 plus 1.5. Generally 3 lakhs will be available when the girl is at 18. So generally this will be sufficient to join any university, no? So that is there. And one more thing we have to know here is that there is a very similar scheme of the central government, that is Sukanya Samriddhi. That's also mainly to improve the sex ratio of the girl child. So what's the difference between this scheme and that scheme then? So the difference is here it was 0 to 2 years to registration, but here it is till 10 years the people can register. And the maturity here was 18 years, but here the maturity year is 21 years. Then we have Manaswini scheme. So this is a scheme of Department of Revenue. It was started in the year 2013. It's mainly basically a pension scheme. So unmarried, separated, divorced women who are lying under the age of 40 to 64 will get around rupees 500 monthly. So I don't know. This is a very small amount actually. If we think like that, okay, we have to just remember the scheme, na? Manaswini and 500 rupees, and it is only for BPL, especially in the rural areas. Then we have to see Matrupurna scheme. Matrupurna scheme is mainly was launched in the year 2017 under Ministry of Women and Child Development, and it aimed to provide one hot cooked meal for the pregnant and lactating women, and additionally for our micronutrients, iron follicle tablets will be given. Two important facts we have to remember here: the institutional delivery in Karnataka is around 99%, and the infant mortality rate of Karnataka currently is 19. This is not, I think in census it is 35 something is there, but currently it is 19. Then we have Pradhan Mantri Matru Vandana Yojana. This was launched in the year 2017. It is a central sponsored scheme. It mainly aims to compensate for the financial loss due to her pregnancy. It is basically for the first two child. For the first child, 5,000 rupees is given, and for a second child, 6,000 rupees year given. And condition here is the second child should be a girl child only. In that case, it is given. And it is extended to all the districts of Karnataka. And one more thing here, we should compulsory Aadhaar is required. Earlier, actually, currently PM2 Matrubandhan 2.0 is running. In 1.0, Aadhaar was not mandatory, but in 2.0, they have mandated the Aadhaar. So I have written this point. Then we have Kishori Shakti Yojana and Sabala. So it is also very clear from the name. What is Kishori means? Kishori means young or adolescent woman. So this is also by the Ministry of Women in 2018. It mainly aims to provide nutritional and non-nutritional support. What is the nutritional support? Providing her micronutrients of iron follicle. And what is the non-nutritional support? Providing the menstrual cups and raising the awareness. Then it is mainly implemented in the aspirational districts of Yadgiri and Raichur. International Women Day. When is it celebrated? It is celebrated on 8th March. And what's the theme of this year 2024? Invest in women to accelerate the progress. Then we have Kitturani Channamma Award. So this we have to remember the amount, how much amount is there. So if this is basically given to those organizations and individuals who are working towards the benefit or the upliftment of the women in the state. So like if they have worked, they should have minimum worked for 5 years. And how much amount is given? 50,000 and 25,000 is given. Then we have Gruha Lakshmi. This was the last year amount, and this is the this year amount. 28,608 last year, and 17,500 this year. Then we also have to look at the pensions that has been increased for some people. For Devadasi, it has been increased from 800 to 1,000 rupees. And Maitri scheme, this is basically for the linguistic minorities, and it has been increased to 1,200. And special category of for rare disease is 1,000 rupees. Then now we move to the schemes that are related to education. So some basic things. Uh, what is the literacy rate of Karnataka as per the census 2011? It is 75.36. This we have to know by heart. And what is the rank of Karnataka as per this census literacy rate? We stand at ninth. And from the last census, that is 2001 census, there has been increased by 9%. Earlier it was 66%, and in the 2011 census it is 75%. 75.36% is. Then we have to also know compare the literacy rate between the states and between our state only. So first let's compare between Karnataka and India. If we observe between Karnataka and India, whether it be overall male or female, it is slightly higher. Karnataka is generally slightly higher, say 75, 74, 82, 82.4, 82.5, 68, 65. So we'll just remember that Karnataka in all the aspects of literacy rate is marginally higher than India. Then we have to see the difference between Karnataka rural and Karnataka urban. So overall the literacy rate of urban is 68 sorry, it is 5.7, and in the rural areas it is 68.7. For males, it is in the rural area they are 77% educated, and in the urban they are 90% educated, and females are 58% in the rural areas and 77% in the urban areas. Then if we have to look as a district wise literacy rate, they will ask the question, arrange them in the increasing order or decreasing order. Generally, if you remember the first three, it is sufficient. So generally we know that coastal states where the fish production is high, we tend to know that they will be much more intelligent now. So first let us place them only. Dakshina Kannada, Bangalore is a rarity, then Udupi. This is sufficient. Dakshina Kannada, Bangalore and Udupi. Then we have lowest. Lowest will be in Yadgiri and Raichur. So maximum is Yadgiri, then followed by Raichur. Then we have some data on elementary education. So primary school has to be constructed in an area where at least 100 people are there and 10 children are there, and it should be within a 1 kilometer range accessible. So for the secondary school it is 3 kilometer, and for high school it is 5 kilometer range. Then we have Samagra Shikshana Karnataka program. This is basically Sarva Shiksha Abhiyan, which for the Karnataka's benefit they have made it little bit Kannadified. That is Samagra Shikshana Karnataka program. So this is basically universalization of education from pre-primary to pre-university. That is free and compulsory education. And it under has three subcomponents under it. That is Sarva Shiksha Abhiyan, Rashtriya Madhyamik Shiksha Abhiyan, and Teachers Education. And the governing council of this is headed by the chief minister. It was established under the Society Act of 1960, and it is a centrally sponsored scheme. Then we have Kalike Balavardhane program. it is also quite obvious from the name. Kalike means learning, Balavardhana means improving our learning. So enhancing the quality of the learning for students is Kalike Balavardhana scheme, and it is from applicable for the class students from 1 to 9 in, and it was launched in 2023-24. So this we have to remember very importantly. No class 10 students are here, only class 1 to 9 for Kalike Balavardhana scheme. Then, as in stress center, we have NCERT. For the state, we have DSCRT, that is Department of State Educational Research Training. This has some programs of this body that are mentioned in the survey. We have to know that. This is Nishta 2.0. So this Nishta 2.0 is basically for training of the PU college teachers. Basically, it is online program only. In their comfort of the home only, they can learn. So this is a zero budget initiative. Means the material available in different platforms will be clubbed under some portal, and the ID and the password will be given so that they can learn. So no new budget reallocation is required for this. Then we have for secondary school teachers, we have training and developmental center at Chalkere. And the DSCRT also mandates the Panch Syllabus. Means these are the what we can say, these are services, or these are the bare minimum things that a educational institution have in the state. That is drinking water, toilet, playground, school building, and a compound wall. These are the five mandatory things that a school should have. Then we have Sambrahma Shanivara program. This is launched on 23 to 24. 2023, 2020 was launched this year, and it is basically a no bag day, and it is celebrated on third Saturday of every month. Then we have Manaka program and Inspire awards. So basically this award is basically for the students from class 6 to 10th. What they will do here is the department of science and tech will give some of the social problems that are in the society. So for these social solution, the children has to come with their innovative ideas. So why this is important is because Karnataka had children of the Karnataka had maximum participation. Around 72 children of Karnataka have participated, and 6 people have also won the award. Means this is a maximum participation and the maximum awards won by any state. So this becomes important, and these 6 students who won, they will be sent to Japan under student exchange program. They will be sent to Sakura, Japan. 6 students, and who have won, they will be sent to, so the Karnataka students have been sent to Sakura under student exchange program. Then we have I think Atal Tinkering Lab. This was launched in the year 2016 by Niti Aayog and Atal Innovation Mission. And one important fact under this is in Karnataka, like around 283 Atal Tinkering Labs are there. Of that, 35% are owned by government high schools. Then this you might have know. Two YouTube channels have been launched by the government of Karnataka, that is Vijay Bhava and Vijay Pata. Vijay Pata, it is basically for the central government jobs, and Vijay Bhava is for the state government jobs. Then we have Janani Shishu Suraksha Karyakram. So this is basically launched in the year 2012, mainly to reduce the out of expenditure of the sick newborn. Means if the child that has been born is suffering from some diseases, so the government wants to reduce the burden from their parents by reducing the out of pocket expenditure. Then we also have RHC portal. This is basically reproductive and child health portal. Means what is this portal? This portal, whenever the child is born, they will collect the data from the mother. Not only born, when the girl becomes pregnant, they will start collecting the data from that time only of the mother and the child. So it is like a tracking system for the reproductive health of the woman and the child. Around 85% of the women and 84% of the children are registered under this portal. Then we have Rashtriya Bala Swasthya Karyakram. So basically, this is a screening program. Generally, this is done in all the government schools, basically for first to 12th standard children. Basically, they mainly screen for any disease, any defects, or any deficiencies are seen in a children. They will be screened, and further, if any action is needed, they will suggest it to the PHC or the district offices. Then we have Mission Indradhanush. So Mission Indradhanush, what is this? This is basically an immunization program. So it has initially it had 7 vaccinations. So only it was called as Indradhanush. So what were those? That are, so first we have to remember like which are the most common vaccination that we know it will be given for the children's: polio, TB, and measles, mumps, and rubella. So this is very obvious. So this will be there. Then we have to remember BTD. BTD is not basics of thermodynamics. Here it is, B stands for hepatitis of B, T stands for tetanus, and D stands for diphtheria, and pertussis. This one we have to remember. These three we can easily do. Then we have intensified mission Indradhanush 5.0 is currently implemented and is running in all the states of in all the districts of Karnataka. Then we have nutrition rehabilitation center. This is also very clear from the name. So what is this nutrition rehabilitation center? It is basically the center of care for the children who are suffering from the severe malnutrition. Let me drink water a bit. So we have Kshira Bhagya scheme. So Kshira Bhagya scheme is basically milk scheme. Means the children will get milk. So how much milk? So they will take 18 gram milk powder and they will mix and they will give to the class children from 1 to 10th in the government and government aided schools. So this is a collaboration of Government of Karnataka and KMF in 2013. Then we have Shuchi Yojane. It is basically the menstrual hygiene for the girls of 6th to 12th class. Basically, they aim to give menstrual cups, and they are also give the awareness related to that. They are going to use these cups, like at least they have use the capacity around, I think, for 10 years, and 8 hours per day, I think, is the capacity of the cups which they are giving. They are basically reusable cups, so once they get, they can use it multiple of times. And this was started from Mangaluru, and the pilot this was launched from Mangaluru, and the pilot project is in Dakshina Kannada and Chamarajanagar, and Saptami Gowda is the brand ambassador of this one. Then we have Mukhyamantri Raita Vidya Nidhi program. So this is basically scholarship to the children of the farmers who want to pursue higher education. So rupees 2,500 to 11,000 is given. Then we have Vidya Nidhi scheme. So this is by the transport department. Mainly it is also a scholarship scheme for higher education, basically for the children of taxi drivers and auto rickshaw drivers. Then we have Sarige Vidya Chetana scheme. So this was just Vidya Nidhi. This was by transport department, but not for the people of the transport department, but it was for the taxi drivers and auto drivers. Here in Sarige Vidya Chetana program, it is for the employees of the transport department. Then we have Kalike Jote Kaushalya program. So this is basically skill training for the final year students of the BA, BSc and BCom, and the training will be provided by the ITI and polytechnic colleges. Then we have Karnataka career planning. So this is basically to provide the career training, means just to create the awareness about what are the flows which you can opt after your 10th PUC or after your degree. So all those boards will be involved now. KSDC, that is Karnataka Skill Development Corporation. Then we have SSC Sarva Shiksha Abhiyan and PU Education Board. Means at the 10th level and at the PU level, it's an important juncture. Na? So at this level, they will give the information like what we need to do. And its motto is my job, my change. My job, my choice. Sorry. Then we have tree park scheme. So this is by the forest department, mainly to provide the natural environment in urban areas, especially for the children well-being and maintenance. Basically, it is basically creation of parks, which we see in Bangalore. Na every, I think, sector has one park, something like that. So this is basically aimed to create the parks so that children can play and well-being in those communities. Then we have Vishesha Palana Yojana. So this is basically financial assistance of rupees 1,000 per month to the children who are affected with the HIV. Then we now move into health sector. So first some basics about health sector. So what is basically health? Health is basically a state of being physical, mental and social well-being, not just mere the absence of disease. It is quite obvious. So this is a actual or the ideal situation for any health sector. So large number of primary sector hospitals should be there, like little bit less than that secondary and little bit less than that tertiary, or super specialty and R&D facility should be there. But in India, it is actually the reverse. We see more number of multi-specialty hospitals and less taluka and district and very least small hospitals. So who is taking this all the structures? Who is giving this all the information and like what should the good structure and all? WHO, which was formed in the year 1948 and headquarters in Geneva. So some important facts also about Karnataka is that Bangalore alone has 33% of the medical establishment. Like think 1/6 of the hospitals of Karnataka are alone in Bangalore. So we can see the glaring difference between the Bangalore and the other parts of Karnataka here. Then WHO also gives some of the ideal values or ideal ratios. For example, as per WHO, the ideal doctor to population ratio is 1 is to 1000, means there has to be one doctor for every 1000 people. In India, the ratio is 1 is to 1456, means like 500 people are extra burden on one doctor. And if we include the Ayush doctors also, then we are actually better than what WHO ask. If we include Ayush doctors, it will be 1 is to 800. Then we have one important development also, like the I think 2023 there was a Gandhinagar declaration on traditional medicines. So they have planned to establish a global center on traditional medicines at Jamnagar. Then we have the bed to population ratio. So the bed to population ratio is 125 is to 1 lakh, means there has to be 125 beds for every 1 lakh population. And in Karnataka we have 90 is to 1 lakh. It is good as compared to other states, but it is still lacking. Then the nurse to doctor ratio actually has improved from 5 is to 1 to 7 is to 1, means earlier under one doctor 5 nurses were there, but currently under one doctor 7 nurses are there. Then we have to also observe the funding pattern in the health sector. So the biggest amount which we get from the center under is the scheme of National Health Mission of 2023. Mean no, National Health Mission. So this is a scheme of 2013, which is an umbrella scheme. Basically, it combined the National Urban Health Mission and the National Rural Health Mission, and it has merged into National Health Mission. It's an umbrella scheme. Under this scheme only, we get the money from the center. So it has actually decreased by 50%. In 2023 they gave us 2300 crore. Now they are giving us only 1100 crore. Why? Election results, of course. But to compensate this, now government has to Karnataka government has to increase its funding now. So from the last year, the state government has increased its funding to the state health budget by 10%. It was earlier 9000 crores and now it is 10,000 crores. Then we have combined funding overall. If we combined these two fundings and see the difference, it is overall down by 26%. And one thing important fact we have to remember in the National Health Mission is mental health not is not a part of National Health Mission. See how comprehensive it is. As per sample registration service, sample registration system SRS, the birth rate is 16.5 and it has been declining, and it is measured for per thousand. What is death rate? It is 6.2 and it is also declining. What is infant mortality rate? We have already seen this, it is 19. Then couples who are using protection is 68%. Then maternal mortality rate has been reduced to 69, and it is this one is per lakh. All others were per thousand, but this is per lakh MMR. Then these two data are quite important because female life expectancy and male life expectancy are stagnant. They are not increasing, not decreasing. What's the female life expectancy? 70.1 or nearly 71, and male it is nearly 68, 67.9 to be much more precise. So female live more than males. Then we have also know the health indicators as per the National Health Family Survey of 2020. This is NHFS 5 actually. So what is the total fertility rate of Karnataka? It is 1.7. It is far less than the national average. We had national target is 2.1. Our state target was 1.9, but we have achieved 1.7. Very good. Institutional births is 97% in Karnataka. Then we have to also know some other data like infant mortality rate from in 2011 census it is 35 and now we have reduced it to 19, and under 5 mortality rate is the highest actually if we consider all the mortality rates. So let me first tell about the all other way mortality rates. First is a neonatal death, means if the death of the child occurs less than 28 days. Neo means new child dying. So new child dies within 1 month or 28 days, it is neonatal. Early neonatal means much before the it born, like less than a week, 7 days. And the maximum death occurs under 5. So this is only under 5 mortality rate is high. This is around 21. Then we have Janani Shishu Suraksha Karyakram. So what is this Janani Shishu Suraksha Karyakram? It also aims to, I think we have seen this one, basically reduce the out-of-pocket expenditure of the parents by giving them around 600 rupees. Then we have Anemia Mukta Paustika Karnataka program by anemia is basically the less amount of blood, means the new child has the very less amount of blood in its body, so we have to provide folic acid syrups to increase its blood. So it is for the children of 6 months to 5 years. Then we have intensive diarrhea control fortnight. Diarrhea means the water content in the child will be less, so we are giving ORS and zinc tablets, and 95% coverage is there in our state. Then we have National Rehabilitation Center. So what is this National Rehabilitation Center? Basically, it aims to basically provide the child care if they are suffering from the severe malnutrition. And where we see the severe malnutrition, especially in Karnataka, North Karnataka and Kalyan Karnataka region. Then we have National Rural Health Mission. This was actually launched in the year 2015, 2005, and it was merged with the National Health Mission in 2013. So what does this do? This mainly provides accessible, affordable, and quality health care to the rural areas, and via how? Via PHCs and CHCs. And it is an umbrella scheme, and it has 11 sub schemes under it. So let us know some of them. Immunization, polio and all. National vector-borne disease control program. So whenever there is a rain, heavy rain, floods are there, they will bring those national vector-borne, some pests will be controllable. They will start flowing that white color smoke. Na? That is this one. Then national tuberculosis control program. We have to know the target. The government of India has set the target of 2005, and 24th March is a TB day, and this year theme is yes we can end TB. And Nikshay portal is also doing dealing with the TB. Then National Leprosy Eradication Program. Basically, Karnataka has only 8 districts that are leprosy affected, and initially we had 40 per thousand cases, but we have reduced it to 0.32, and our target is to make them 0 by 2027. It will happen definitely. Integrated disease surveillance program. So what is this? Basically it is surveillance, means if there is any diseases, like say for example dengue is, if the hospitals are getting more number of dengue cases, they have to inform it to the district hospitals. These district hospitals will again inform it to the state government, and this state government again will tell to the central government. So like this surveillance integrated surveillance of the disease is called as IDSP. Then we have a concept that we have to know what is the difference between endemic, epidemic, and pandemic, because COVID-19 was there. So what is endemic? Which is located to a specific area. For example, in Karnataka, we have this KFD, na, Kyasanur forest, this is which affects the monkeys, especially in the Western Ghats. So this is specific to that location. Generally, Shimoga, Chikmagalur districts it is seen. So this is endemic. Then we have epidemic. Epidemic means still larger than an area. Means, say for example, an continent, if it is affecting a continent. So for example, Middle East respiratory syndrome, so this is an example for an epidemic. Then we have pandemic. Pandemic means global, all will be getting the disease. So best example is COVID-19. Then we have Suvarna Arogya Suraksha Trust. So this is basically an implementation agency that mainly oversees the insurance schemes of Karnataka. So what is that insurance scheme? The insurance scheme of government of Karnataka is Arogya Bhagya scheme. It was launched in the year 2009, and we were the first state to provide the universal health coverage. Government of India, which we know currently has the Ayushman Bharat, na, there is a copy of ours, so our Arogya Bhagya scheme actually. So we will know about that also. Ayushman Bharat, actually it was launched in the year 2019 by Ministry of Health, and basically it has two components. One to deal with the primary sector, and next is the secondary and tertiary sector. Means second, tertiary sector in the sense hospital. So in primary care, what we need, we generally need large amount of hospitals, and which are treating for small diseases like cough, cold, and all. So they have established Ayushman Bharat Arogya Kendras, which will now will be called as Arogya Mandirs, and they are also providing free of cost or very low cost tablets under Janaushadhi Kendras. And in Karnataka, it is implemented in the name Ayushman Bharat Arogya Karnataka scheme. And in the secondary and tertiary sector, here like government has less number of hospitals now that are mainly well versed with the secondary and tertiary sector. So what it will do, it will give the insurance. How much? 5 lakh per annum per family, but no family size is fixed. and it has selected some hospitals which it calls as M-paneled hospitals. So in these M-paneled hospitals, we can go with our Ayushman Yojana health card, or ABA ID is there now. With that, we can get the treatment of 5 lakhs. Then we have Jyoti Sanjeevani scheme. So Jyoti Sanjeevani scheme is basically a scheme for the state government employees. It is basically cashless and no financial limit. So this is very important, and it mainly help the state employees very much like us. Then we have National Urban Health Mission. So this was in 2013, and it mainly aims to improve the health of the urban poor and the urban dwellers. So it has created like a two-tier structure. That is, first is at the very local level we have Namma clinics for 15,000 to 20,000, and then after this we have urban primary health care center, which we call as PHCs. Na, these are those. So this will serve for 50,000 to 60,000. If it gets cleared here only Namma clinic, it is fine. Otherwise, they will push it to PHCs. So the size will be higher here. Then we have some e-governance scheme that are mainly related to hospital and all. First is the health management information system, which will be there at the district level. Then we have RHC portal, about which we have seen. Then we have Rashtriya Bal Swasthya Karyakram. We have seen this also. Basically, this is the early identification of defects, deficiency, disease, and disabilities, and it is for the government schools and colleges, and 61% coverage we have seen. Then in Suchi also we have seen reusable cups for 10 years and up to 8 hours per day. The mission Indradhanush we have also seen. It basically aimed at 90% immunization coverage, and intensified Indradhanush means 100% coverage. And Karnataka's coverage of immunization is around 64%, and currently IMI, that is in the mission Indradhanush 5.0, is currently running, and it has been completed in October 2023. Now we have some of the schemes that are related to mental health. So district mental health program. So this is at the district level where there will be doctors and psychiatrists will be assigned to in all the 31 districts. So like whenever if there is an issue of mental health, you can directly go to the district health centers and get it sorted. If you are not staying in the district, if you are staying in the taluka, it is really difficult to get psychiatrist to the taluka level now. So they have created a scheme called as Mano Chaitanya. So under this, they are going to have Super Tuesday clinics. Means on every Tuesday, the people or the psychiatrist from the district will come to taluka, and from all it will be for all talukas only, and there you can get treated for your mental healthness. Then we have Manasadhare. So Manasadhare, it is basically a daycare center for those people who have been recovered from the mental challenges. It is not in all districts, it is specifically in the 4 districts which they have found to be important. Then telecounseling is there, you know that what is this. Then we have Karnataka is the first state to implement the e-hospitals, and Karnataka ranks 10th in ABA cards, that is Ayushman Bharat Health account number cards. Then Karnataka also ranks 4th for implementing the e-Sanjeevani, that is telemedicine. Then we have Karnataka State AIDS Prevention Society. This is headed by the Chief Minister, and the first case of AIDS was found in Belgaum district, Saudatti, in 1988. And like Karnataka is a high prevalent state because around 26 districts are affected by the AIDS. Then we have some schemes for the AIDS patient also. So first scheme is the Chetana scheme. This is basically for the sex workers. And one thing we have to remember here: no money is given under the Chetana scheme. They will be just given skills. No money, but only skills. Under Dhanashri's Yojana, Dhana means money. So now money will be given. Around 30,000 rupees will be given. And from this 30,000, they can set up their own business or anything they can do. Then if they need home, they have Devraj Aras scheme, and there will be free education for their children. Then we have Ayurvedic Medicine Museum will be in Bangalore, and the government Ayush Composite Hospitals will be established in Yadgiri and Chitradurga. And child sex ratio in 2000, as per the 2011 census, was 948, and as per the 2001 SRS, that is a sample survey something is there, no? It will be 941. Then we have Help Educate. So this is basically by the Department of Collegiate and the Technical Education to revamp the curriculum, and this is mainly in partnership with Infosys. Then we have Swavalambi scheme. So basically this is basically to those people who want to set up the mobile showrooms and mobile shops. If they will be getting some subsidies. If they want to set up in taluka level, 2 lakh rupees subsidies; at district level, 3 lakh subsidies; and Mahanagarapalika, 24 lakh subsidies; and in BBMP limits, 5 lakh subsidies. So how many religious minorities are there in Karnataka? Around 15.2% of the population of the state Karnataka is the religious minority. If we have to look in actual numbers, it is 96 lakh. We can remember nearly 1 crore. Then we have Vidya Siri scheme. So this basically is government of Karnataka wants to aims to provide what it wants to aim to provide. It wants to aim scholarship basically with respect to food and accommodation for the people who want to pursue higher education after the metric, basically for the children of minorities. So if they did not get the food and accommodation facility, because hospitals, government hospitals are very limited, na. So if they did not get, the government will give money. How much money? Rupees 1500 per month will be given for the 10 months, and total of 15,000 per year will be given to them. Then we have a REU scheme. So a REU scheme, it is basically an education loan scheme. So it is basically for the religious minorities. So around 50,000 to 5 lakh rupee will be given every year and they should repay after the 6 months of completion, of course, at the interest rate of 2%. Then Karnataka has 1.65 lakh self-help groups with 25 lakh women in it, and Karnataka is one of the 3 states that is implementing the gender budget. I think around 86,000 crore or 84,000 crore, some amount is given in this budget as per gender, for the gender budget. Then we have Chief Minister Bala Seva Yojana. This is basically for the children who have lost both of parents or are a single parent due to COVID-19, and around rupees 3,500 a month is given to them. After that, we have UNDP's Human Development Index rank. So why is this important? Because we have to know the rank of 2021, because it is given in our economic survey. They said that in 2021 our rank was 132. If they ask the current rank, it will be 134. This is also important because India has shown a decline in its Human Development Index from 0.64 to 0.63 for the first time in the last 30 years. Then we have to also know about the National Multi-Dimensional Poverty Index, which is released by the Niti Aayog. It has basically 3 parameters: health, education, and standard of living. And we have to know this important fact also, like in the last 9 years, around 24 crore people, that is 240 million people, have been brought out of the multi-dimensional poverty. Then we have to know what is the human development of Karnataka, because we are the first state to release the state-wise, means the state-wise entire districts will be given their rating as per the human development. So we were the first state. We gave our first report in the year 1919. Totally we have 4 reports. One was in 1999, second 2006, 18, and recent one is the 2023. So for the 2023, what did they name it, or what was the theme of that? Bridging gap towards sustainable well-being. So it is in 2014 we were successful in giving HDA for all the districts. Then it was 30, now it will be for 31. Then we have Global Inequality Index. So what is this Global Inequality Index? This is a report basically by the World Economic Forum, which mainly says that how we are close to reduce the inequality in our society between men and women. So it measures this based on health, empowerment, and labor market. In health, they calculate MMR, adolescent birth rate, and in empowerment, they calculate the women participation in the parliament and the secondary education. And in the labor market, how many women are participating. India's rank in 2024 is 129. So I think that's it. Tomorrow we'll see environment and agriculture. Thank you.